Hello friends. This week in Washington produced several significant developments that directly affect your Social Security check, your Medicare coverage, your prescriptions, and your medical care. Most of it did not make the evening news. Today, I'm going through all of it. What happened, what it means for you specifically, and what you need to do about any of it. Before we get into it, subscribe to this channel right now and turn on the bell. News like this moves fast, and most people only find out about developments like these weeks or months after they happened. Subscribe now and let's get into it. Let's start with Social Security and the number that every person receiving benefits is going to care about most heading into the fall. On July 14th, the Senior Citizens League released its updated projection for the 2027 cost of living adjustment. The current estimate is 3.8%. That is based on the most recent available Consumer Price Index data, and it is meaningfully higher than what most people have been receiving in recent years. In 2026, the COLA was 2.5%. The 2025 COLA was 2.5%. A 3.8% increase for 2027 would be the largest adjustment since the 5.9% and 8.7% increases of 2022 and 2023. In real dollar terms, on the current average Social Security retirement benefit of approximately $2.71 per month, a 3.8% COLA would add roughly $79 per month beginning in January 2027. For a couple where both spouses receive benefits, that could mean $150 or more in additional monthly income. Over a full year, a single beneficiary would receive approximately $948 more than they do now. Here is the critical thing to understand about this number. Right now, the Senior Citizens League's 3.8% estimate is a projection, not the official figure. The official 2027 COLA will not be announced until October, and it is calculated using inflation data from 3 specific months, July, August, and September. The July data being collected right now is the first of those 3 months. If inflation remains elevated through the summer, the final official number could come in at or above 3.8%. If prices cool significantly over the next 2 months, it comes in lower. The point is, July matters. What happens to grocery prices, energy costs, and medical costs this month and the next 2 months directly determines the size of your January check. Also this week in the Social Security space, the Social Security 2100 Act was reintroduced in Congress. This bill has been proposed multiple times over the years and has never passed, but it represents the most ambitious Social Security reform proposal currently active. It proposes a 2% across-the-board increase to all existing benefits separate from the annual COLA, a minimum benefit floor set at 125% of the federal poverty level to ensure no senior falls below a certain income. And a switch from the CPI-W inflation formula to the CPI-E, which calculates inflation based on the spending patterns of Americans 62 and older rather than the general working population. The CPI-E consistently produces higher COLA adjustments because older Americans spend proportionally more on healthcare and housing, which have inflated faster than the general index. Analysts give this bill a low probability of moving quickly through the current Congress, but it is in play and being discussed. Now, Medicare and this week produced 3 significant developments in a single day. On July 16th, the Senate voted to keep in place a program called WISER, the Waste and Improper Payment Savings and Efficiencies Reform Pilot. This is an AI-based prior authorization system currently operating in 6 states: Arkansas, Florida, Illinois, Ohio, North Carolina, and Texas. Here is what this means in plain terms. For certain Medicare-covered procedures in those states, an artificial intelligence system reviews the request for that procedure before a human claims reviewer sees it. The AI can approve it, flag it for human review, or in some cases generate an initial denial. The practical consequence, which is the reason Democrats tried to repeal the program this week, is that some patients in these 6 states are experiencing delays in receiving care because an AI algorithm is slowing the approval process. Republicans voted to keep the program in place, arguing that it is an effective tool for identifying fraudulent billing and that the efficiency savings justify the pilot. The program remains in effect. If you are in one of those 6 states and you have had a procedure delayed, denied, or returned with an unusual explanation recently, this program may be part of what happened. Under Medicare rules, you have the right to appeal any prior authorization denial and to request that a human medical professional review the decision, not an AI. Call 1800 Medicare. That is 1-806-33-4-227 and ask specifically about your right to a human review of a prior authorization decision. Also introduced on July 16th, the Medicare Cost Cap Act, sponsored by members of the Senate Finance Committee. This bill addresses one of the most significant structural differences between Medicare Advantage and Original Medicare. Medicare Advantage plans are required by law to include an annual out-of-pocket spending cap. In 2026, no Medicare Advantage enroll should pay more than $9,350 in out-of-pocket costs in a single year. Original Medicare, the traditional fee-for-service program, has no such cap. There is no ceiling on what you can owe in a single year. A hospitalization, a serious illness, a surgery with multiple follow-up procedures. The bills can stack with no limit. The Medicare Cost Cap Act would change this by creating a statutory maximum on annual out-of-pocket costs for Original Medicare beneficiaries. The bill was introduced this week. It has not passed. It will need to move through committee and survive a floor vote. But it represents real legislative momentum on a protection that millions of seniors in Original Medicare currently lack and that their counterparts in Medicare Advantage already have. On the same day, Representative Tom Caney Jr. introduced the Medicare Premiums Reduction Act. This bill targets the IRMAA surcharges, the additional monthly Medicare premiums charged to higher income beneficiaries. In 2026, single filers with income above $16,000 and married filers above $212,000 pay elevated Part B and Part D premiums on top of the standard amounts. The surcharge tiers can add anywhere from roughly $74 to $444 per person per month. The Premiums Reduction Act proposes reducing or eliminating these surcharges for what it defines as middle-income beneficiaries, people whose income puts them in the lower IRMA tiers, but who live in high cost of living areas where $16,000 represents a modest rather than a wealthy income. This bill is also a proposal, not law. But combined with the Cost Cap Act, July 16th produced two serious legislative efforts aimed directly at reducing what seniors pay for Medicare coverage. On the prescription drug side, the GLP-1 Bridge program, the new Medicare benefit that began July 1st, covering obesity medications, including WGO and Zepbound, for a flat $50 per month, generated a new and unexpected debate in medical circles this week. The question being actively discussed in medical economics publications: should there be an upper age limit, perhaps 80 years or older, for access to GLP-1 medications through the Bridge program? Some health economists are arguing that the research base for these medications in very elderly or frail patients is limited, that the weight loss effects in this population are less well studied, and that without some age-based structure, the program could face significant budget strain given how expensive these drugs are at standard pricing. Others strongly oppose any age cutoff, arguing that excluding patients based solely on age is discriminatory, and that many seniors over 80 have significant obesity-related cardiovascular conditions that these medications could address. No decision has been made, and the program currently has no upper age limit. All eligible Medicare Part D enrolls who meet the clinical criteria, BMI of 35 or higher, or BMI of 30 or higher with qualifying conditions, can apply regardless of age. But this debate is real and active. If you are in your late 70s and considering applying for the GLP-1 Bridge, starting sooner rather than later is the more prudent choice given that program rules can change as the policy debate evolves. Finally, a reminder that is especially important for SSI recipients. The second Social Security payment of July arrives on July 31st. This is your August Supplemental Security Income benefit, arriving early because August 1st falls on a Saturday, and federal law requires that payments scheduled for a weekend be issued on the preceding business day. The last business day before August 1st is Friday, July 31st. This deposit is your August payment. It is not extra money. It is not a bonus. And there will be no new SSI payment in August. If you spend both the July 1st and July 31st deposits before August arrives, your bank account will show nothing incoming for the entire month of August. Budget the July 31st deposit as if it has a label on it that says do not touch until August 1st. So here is the week in summary. COLA 2027 is currently projected at 3.8% by the Senior Citizens League as of July 14th. The official number comes in October and depends on July, August, and September inflation data. Social Security 2100 Act, reintroduced with a 2% base increase, minimum benefit floor, and CPI-E formula switch. Ambitious but uncertain timeline. Senate kept the Wiser AI prior authorization program running in 6 states. If you are in those states, you have the right to request human review of any AI-generated denial. Medicare Cost Cap Act and Medicare Premiums Reduction Act, both introduced July 16th. Proposals to watch as they move through Congress. GLP-1 Bridge program remains open to all eligible seniors with no age limit despite active policy debate. Apply now if you qualify rather than waiting to see how the debate resolves. And SS&I recipients, your July 31st payment is August money. Protect it accordingly. Subscribe. Share this with someone you know who is on Social Security or Medicare. And I'll see you in the next